Hello guys, good evening. It's a very warm Saturday evening. I'm Dr. Kartik. I'm a senior hematologist at Madras Medical College and I'm working as a locum consultant at Mehta Hospital. And this is my first class on the super specialty course on the hematology and the medical oncology topics for the coaching. So I will start with the basics topic today. Since the first class, I don't want to have more of a complicated topics, and I will go with basics in hematology, which is hematopoietic stem cell transplant and the basic approach to anemia. So this topic is also very important from the INISS point of view, as well as in the basic hematology, how hematopoiesis starts. So I will start my class now. So the important topic in hematology is the basic of hematopoietic stem cells. Thus, please respond by saying yes, am I audible? Hello guys, am I audible? Yeah, thank you. Thank you, Samshuddha. Thank you. So I will start with the basic of hematopoiesis. In this class, I will deal about the biological properties of hematopoietic stem cells, as well as the basic hematopoiesis and approach to anemia. So this is an important cartoon which shows the age of hematopoiesis starting from in utero life to extrauterine life. So the initial hematopoiesis starts in the extra-embryonic yolk sac. On the cartoon on the first left, you can see week 2.4 to 4 weeks of gestation.
सॉरी सर इंटरप्ट के लिए, लेकिन आपकी स्क्रीन नहीं आ रही सर.
स्क्रीन विजिबल नहीं है.
आपकी विजिबल नहीं है सर. पीपीटी तो आ रही है.
हाँ, फेस तो मैं हाइड किया जी, बिकॉज पीपीटी इंटरफेयर आ रही है ना. ओके, सो आई विल स्टार्ट विथ the basic of hematopoietic stem cells. So on the top, on the first left corner, you can see the yolk sac. So the basic hematopoiesis starts in the extra embryonic region called the yolk sac, where you can see the red blood cells engorging the yolk sac. The first cell to appear in the yolk sac is the red cells. These red cells are important for the developing cardiovascular system in the early hematopoiesis. So following this yolk sac, we can see the cells getting aggregated in the AGM region, aortogonadal mesonephros region, following which in the early second trimester, hematopoiesis starts in the liver and spleen, and followed by the bone marrow starts to kick the hematopoietic process. So the important points to be taken in this slide is hematopoiesis begins as early as 3 to 4 weeks of extra embryonic yolk sac, followed by hematopoietic system taken care by liver and spleen, followed by the bone marrow. So, as I mentioned, earliest cell of immune system start is the macrophages, because macrophages are the innate immune system, and it's an important component of microglial cells in the nervous system. So the early cell to start is the macrophage, and as I mentioned, in the second trimester, liver and spleen starts to kick in with RBC, platelets, and innate immune cells, followed by the bone marrow. So this is a famous picture which we always This is a famous picture which we always know. What are the three embryonic hemoglobin which we see? GOBER1, GOBER2, and the hemoglobin Portland. In this, the most important embryonic hemoglobin is the GOBER2. I can teach you how to read the hemoglobin structure without even mucking it up. This is the most important hemoglobin chain called as the beta hemoglobin chain. Next is the alpha hemoglobin chain. The design is so perfect that the hemoglobin process starts from the top left. Here you can see a region called LCR region, where all the transcription factors required for hematopoiesis kicks in, and from this LCR region, the transcription factors goes and bind to epsilon, gamma, beta, delta, and beta region. So hematopoiesis always starts from left to right concept in the beta gene, left to right concept in the alpha genes. So you can see the initial over one is left zeta 2 and the eta 2. One, this hemoglobin starts, the next hemoglobin form, which is the alpha 2 and the eta 2. Once the third hemoglobin starts, it is again the zeta 2 and the gamma. Always hematopoiesis starts from the left side, and then finally it reaches the adult hemoglobin, which is alpha and delta for A2, alpha and beta for the hemoglobin A. So when we remember this diagram, we can easily understand the hematopoiesis starts from zeta, epsilon, followed by alpha, epsilon, followed by zeta and gamma. So these three hemoglobin form the basis for the embryonic hemoglobin, followed by the fetal hemoglobin, which is alpha and gamma, followed by the adult hemoglobin, alpha delta for A2, alpha beta for hemoglobin A. So what are the important properties of hematopoietic stem cell? So the frequently asked question about this, what is the stem cell marker? What are all the CD markers which are helpful in hematopoietic stem cell lineage? This is the answer. Answer is CD34 positive, it is lineage negative, it is CD38 negative, and it is Thai1 positive. So just try to remember this marker. All hematopoietic stem cells are CD34 positive. CD38 and lineage are subsequent progenitor cells. Stem cells lack lineage specificity, and lineage is indirectly noted as CD38. As stem cells are lineage negative because it can differentiate into any kind of cells. And the progenitor cells are lineage positive. So when lineage is negative, CD38 is negative, and Thai refers to the thymic expression of the stem cells. Because the hematopoiesis, thymopoiesis starts in the thymus region, so stem cells are Thai1 positive. So property of stem cells are persistent throughout the life. So even from the embryonic life to the adult life, stem cells are persistent throughout the life. That is the reason even in age of 70 and 80, people keep on getting good hematopoiesis, good hemoglobin, good platelet, and good counts. So stem cells has an excellent self-renewal and differentiating capacity. Stem cell undergoes symmetrical and asymmetrical cell division, which I will deal in subsequent slides. What is this excellent property of symmetrical and asymmetrical cell division? And this is the most important concept. Stem cells are stress responsive. That means whenever patient gets any acute fever, acute viral illness or a bacterial illness, acute trauma, acute injury, post surgery, there will be a surge of stem cell pool. This surge of stem cell pool causes an increase in erythropoiesis, thrombopoiesis, and leukocytosis. That's why stem cells are stress responsive. Stress responsive in the sense also chemotherapy, radiotherapy, stem cell transplant, all procedures are stress responsive. So these stresses stimulate the self-renewal and differentiating capacity of hematopoietic stem cells. Stem cells are normally quiescent in nature. What is quiescent? Quiescent in the sense they won't normally respond to any kind of cytokines or chemokines. Only when they undergo stress, they are easily triggered by cytokines. Example, GCSF, erythropoietin, thrombopoietin. These are all various cytokines which are helpful in erythropoiesis, thrombopoiesis, and granulopoiesis. Normally, hematopoietic stem cells are not stimulated by GCSF, erythropoietin, thrombopoietin, whereas the mature cells like neutrophils, RBCs, red cell progenitors, megakaryocytes are easily stimulated by the growth factors, not the hematopoietic stem cells.